Have you ever stopped to think that a simple trip to the hospital could turn into a risk greater than the disease itself? Can you imagine that a routine exam, sold as safe, could bring complications so serious they might cost a life? And more. Do doctors really tell the whole truth about these risks, or is their information deliberately hidden? These questions may seem exaggerated, but by the end of this video, you'll uncover the truth about 4 medical exams that can be fatal for people over 70. And today, I'll also reveal which safe alternatives exist that many doctors don't mention. You'll be shocked by what's not being said, and this could protect your life or the life of someone in your family. My name is Kenji Oshiro, and this is the Global Health Guide channel. Subscribe now so you don't miss content that can truly make a difference in your health and well-being. To help you understand the gravity of the issue, let me share the story of Margaret Collins, a 74-year-old woman who went to the hospital for a preventive colonoscopy. The doctors said it would be quick and risk-free, just routine. 3 days later, Margaret passed away. During the exam, her intestine was perforated, something extremely rare in younger people but much more common in the elderly. She suffered internal bleeding, and by the time the doctors noticed, it was too late. Stories like Margaret's are not isolated exceptions. Serious studies show that the rate of complications in invasive exams increases alarmingly with age. But this detail is rarely explained. Consent forms are filled with complex medical terms, tiny print, and long lists designed so most people sign without understanding anything. What patients don't know is that the risks for someone over 70 are nothing like those for a 40-year-old adult. Here's what's almost never said. Exams that seem simple can become traps for the elderly because the aging body reacts differently. Healing is slower, the skin is thinner, organs become more fragile, and tolerance to medications and anesthesia drops drastically. What's safe for someone middle-aged can be devastating for an elderly person. What's most frightening is realizing that many doctors follow protocols created for younger adults and apply the same standards to patients who are 70 or 80 years old. The result? More complications, more after effects, and, in many cases, deaths that could have been avoided. It's no coincidence that estimates suggest tens of thousands of elderly deaths each year are directly linked to routine medical exams. You might be wondering, why does this happen? If doctors know the risks, why do they keep recommending them? The answer, unfortunately, involves money. Invasive exams generate billions. A single procedure can yield thousands of dollars for hospitals and clinics, while safer, much cheaper alternatives bring in almost no financial return. This creates a system where profit often outweighs patient safety. And don't think it's just cold statistics. For every number, there's a life, a family, a future cut short. Take the case of Edward Miller, 78 years old. He felt only occasional mild palpitations. His doctor insisted on an immediate cardiac catheterization, saying it was the only way to be sure there was no greater risk. During the exam, a piece of calcium broke off from his arteries and reached his brain. Edward suffered a stroke and was left paralyzed on half his body. Before the procedure, he walked every day. Afterward, he needed daily care. What's most infuriating? Studies show that in many cases, invasive exams like catheterization could be replaced by simple methods like a stress electrocardiogram or heart ultrasound without exposing the patient to such high risks. But these alternatives are rarely offered, precisely because they don't generate as much money for the system. Here's a question for you. Have you ever been in a situation where a doctor recommended an exam and you wondered if it was really necessary? Leave your answer in the comments, because sharing experiences can open people's eyes. What's clear is that the combination of blind trust in doctors, technical language in forms, and emotional pressure at the moment turns the elderly into easy targets. Often, they're led to believe that refusing an exam would be irresponsible or even dangerous. But the truth is that, in many cases, the risks outweigh the benefits. As this video continues, you'll understand exactly which exams these are, the real numbers behind complications in the elderly, and most importantly, how to protect yourself. And pay attention. Before the end, I'll reveal 5 essential questions you must ask your doctor before agreeing to any procedure. These questions could literally save your life. By now, you've realized that the hidden risk in seemingly common exams is no exaggeration. Margaret Collins's case showed how a simple colonoscopy can turn into a death sentence for the elderly. But she's not alone. There are other exams that, despite appearing routine, can bring serious complications, especially for those over 70. One of these is cardiac catheterization. It's sold as a high-precision procedure capable of identifying heart problems in detail. The idea of seeing inside the arteries seems reassuring, but the truth is that for many elderly people, this exam can be more dangerous than the disease it's meant to investigate. The procedure works like this. A doctor inserts a thin tube into an artery, usually in the groin or arm, and guides it to the heart. There, the catheter injects contrast dye so the coronary arteries can be visualized on a monitor. It sounds simple, but in the body of someone elderly, this can become a deadly trap. Elderly arteries are often stiffer, more fragile, and covered with calcium plaques. When the catheter passes through, there's a risk of dislodging some of these plaques. That fragment can travel through the bloodstream to the brain, causing a stroke. That's why studies show that in patients over 75, the risk of a stroke during a catheterization is nearly 5%. This means that for every 100 procedures, 5 can end in a stroke, some fatal, and that's not all. The area where the catheter is inserted, usually a large artery, may not heal properly in the elderly. Thinner skin and more fragile blood vessels increase the risk of internal bleeding that can be hard to control. Plus, the contrast dye used during the exam can cause kidney failure in aging kidneys, which no longer filter toxic substances as efficiently. This is exactly what happened to Walter Johnson, an 80-year-old man. He had only occasional mild palpitations, nothing that disrupted his routine. Even so, his cardiologist recommended an immediate catheterization, saying it was just to be sure. During the exam, Walter suffered a stroke. He survived but lost his speech and part of his mobility. His wife said that before the procedure, Walter still danced with her on Sunday afternoons. After the exam, his life changed forever. What makes it even more infuriating? In many cases, the catheterization wasn't even necessary. Simple exams like a stress electrocardiogram or stress echocardiography could provide the same information without the risks of inserting a catheter. The difference is in the profit. While these tests cost little, a catheterization can generate thousands of dollars for hospitals and clinics. Now think about it. If you or someone in your family were in Walter's place, would you accept the risk without questioning, or would you want to know first if there's a safer path? That's why I insist that asking questions can be the difference between leaving a doctor's visit healthy or carrying lifelong consequences. But it's not just invasive exams that hide dangers. A silent threat to the elderly comes in even more common situations. Surgeries with general anesthesia. Anesthesia is seen as a solution to avoid pain and discomfort during procedures. For young, healthy people, it's usually safe. But in the elderly, the reaction can be completely different. The aging brain is more sensitive to anesthetics. Substances that should clear in a few hours can remain active for days or even weeks. This causes a state of mental confusion called postoperative cognitive dysfunction. The patient wakes up but isn't the same. They don't recognize family members, can't orient themselves in space, and may completely lose recent memory. In about 30% of elderly people over 75 who undergo general anesthesia, this condition appears. And in roughly 12% of them, the problem never reverses. In other words, a single surgery can turn a lucid, independent person into someone dependent, with symptoms similar to dementia. Take the case of Edward Miller, 78 years old. He needed a simple surgery to repair a hernia. Before the operation, he led an active life, managed his household alone, and even drove. After general anesthesia, he woke up not recognizing his own daughter. His condition didn't improve, and today Edward lives in a care facility with no memory of his past. The surgery was technically successful, but his life changed forever. The most painful part is knowing that many of these surgeries could use local or regional anesthesia, which doesn't affect the brain. But general anesthesia is more convenient for the medical team and generates more revenue. That's why thousands of elderly people are exposed to unnecessary risks every year. I want you to reflect. Have you ever known someone who, after a surgery, was never the same? If so, write in the comments. Your experience could help others realize this problem is real. What's evident is that we need to break the silence around these practices. Many doctors avoid talking about alternatives because it would reduce the number of exams and, consequently, hospital and clinic revenue. But the life of the person on the operating table should be worth more than any profit. And we're not done yet. There's one more exam, very common and seemingly harmless, that can be devastating for the elderly. Tests that use chemical contrast in CT scans and MRIs. These exams seem modern and safe, but they hide serious risks for fragile kidneys and even the brain. We've seen that both catheterization and general anesthesia can become traps for the elderly. But there's still one more exam that, while presented as safe and modern, can have devastating consequences. Exams with chemical contrast, like CT scans and MRIs. In theory, they're powerful tools for seeing details of the human body, but in practice, for someone over 70, the contrast can mean a life-threatening risk. This happens because the contrast is a toxic substance that needs to be filtered by the kidneys. In young people, the body eliminates it quickly, but in the elderly, whose kidney function is naturally reduced, the contrast can build up and cause kidney failure. Studies show that up to 15% of patients over 75 develop kidney damage after a contrast-enhanced exam. In some cases, the damage is irreversible, and the person becomes dependent on dialysis for the rest of their life. Imagine the situation. You go to the hospital for a simple investigation and leave with a problem that completely changes your routine. And it doesn't stop there. Some contrasts used in MRIs contain heavy metals like gadolinium. Recent studies suggest this metal can deposit in the brain and cause long-term neurological damage. We don't yet know all the effects, but there's already evidence of memory and reasoning problems in patients repeatedly exposed to this substance. One case that illustrates this risk is Walter Johnson, 80 years old. After an MRI with contrast, he suffered a severe reaction that compromised his kidneys. Walter never regained the same quality of life. Later exams showed there were alternatives that didn't require contrast, but those options were never offered. What's most infuriating is that, in many cases, there really are alternatives. Ultrasound, for example, can evaluate internal organs safely, without radiation or chemicals. In some scenarios, an MRI without contrast would be sufficient. But since these procedures are less lucrative, they're often not even mentioned to the patient. And this is where the biggest problem lies: silence. Many doctors know the risks increase with age but prefer not to go into detail to avoid scaring patients. The result is that thousands of elderly people consent to exams without knowing the real consequences. So I want to share something essential with you. These are 5 questions that can save lives. Before agreeing to any invasive or contrast-enhanced exam, make sure to ask these questions to the doctor. The first question is, what's the risk of this exam for someone my age? Don't accept a vague answer. Demand numbers, specific statistics for your age group. The second question, are there safer alternatives to reach the same diagnosis? Often there are less aggressive methods, but they're only explained when the patient asks directly. The third question, what happens if I don't do this exam now? In many cases, nothing serious. Some exams are more about reassuring the doctor or protecting the hospital legally than saving lives. The fourth question, does this exam bring any additional financial benefit to the clinic or hospital? This question may seem awkward, but it exposes the conflict of interest that often exists in the healthcare system. And the fifth, perhaps the most powerful, if this were your father or mother, would you recommend this exam? A sincere answer, or even the doctor's hesitation, can say a lot. These questions aren't meant to create conflict, but to ensure you get a clear and honest explanation. Remember, no doctor can force you to undergo an exam against your will, and you always have the right to a second opinion. Think about Margaret Collins, who died after a colonoscopy. If someone had asked about the specific risk for people over 70, maybe the numbers would have come up and a safer alternative might have been considered. And I want you to reflect, which of these exams surprised you the most? The colonoscopy, the catheterization, general anesthesia, or the contrast exam? Write in the comments, because your participation can alert others. Now you know the truth is harsher than it seems. The healthcare system often treats the elderly as numbers on a spreadsheet, where profit speaks louder than safety. But you don't have to accept this in silence. Knowledge is power, and now you have the tools to protect yourself. The next time someone suggests an exam, remember you have the right to ask, to refuse, and to seek alternatives. Don't let haste or fear decide for you. Sometimes saying no can save your life. And don't keep this knowledge to yourself. Talk to your parents, grandparents, uncles, friends. Many of them still believe that if the doctor recommended it, there's nothing to discuss. But now you know that questioning is essential. You could be the person who opens someone's eyes and prevents a tragedy. So I want to ask you, which of these 5 questions will you use first at your next doctor's visit? Write in the comments. If this content made sense to you, like this video, share it with someone in your family, and don't forget to subscribe to the Global Health Guide channel. Together we can create a more informed and aware community, capable of turning fear into protection and silence into power.